Hello, I am Landon Cole, and this is Idb1 for Dr. Pruitt's Choice Assignments. So the thing I will be talking about today is Down syndrome. So Down syndrome, the actual definition of it is a genetic disorder that affects chromosome 21 in a person by making an extra copy of it. It is categorized as a genetic disorder and can affect anyone. Down syndrome is usually diagnosed within the fetus in its first trimester between 10 and 13 weeks. It is a congenital disorder that affects physical appearance and congenital development. The main cause of Down syndrome is that in chromosome 21, an extra copy is made in that chromosome. There are three types of Down syndrome. The first one is trisomy, the second one is translocation, and the third is mosaic. The most common is trisomy 21. That affects most people in the world who have Down syndrome. Translocation affects about 3% of the world of people with Down syndrome, and mosaic affects about 2% of the world's population with people with Down syndrome. So with having Down syndrome, there comes a lot of things that goes with it. And by that I mean there are other illnesses that Down syndrome may bring with it. So a couple of those are hearing loss, obesity, sleep apnea, and a handful of other things. But the three main things and most serious thing that Down syndrome may bring is heart problems, blood disorders that can lead to cancer, and a immune system problem. But people with Down syndrome who have the heart problems, most of those are very repairable heart defects that can be repaired. And people with Down syndrome, there's obviously differences between them and people without Down syndrome. So people with Down syndrome, for instance, they have intellectual disabilities, which it's harder for them to process things and learn things. And they also have physical appearance problems. So some of their physical appearances may include bridge of the nose, flattened face, a shortened neck, small ears, and their eyes. Their eyes are also a big deal of knowing when people have or don't have Down syndrome. So because of this, there are many recommendations and considerations that people must take in hand for people with Down syndrome. There are restrictions in cardiovascular and resistance-based exercises, and this is caused by poor muscle development and incompetence in some activities. The activity recommendations for people with Down syndrome is that they must do either moderate or vigorous exercise, but it is highly recommended that this is between a time limit of 75 minutes per week.